Welcome back. So, depression is another ancient disease. It was described by the Mesopotamian people in about 2000 BC, but it's also described by many ancient civilizations, including the Chinese, the Egyptians, the Babylonians, etc. And then our friend Hippocrates in 400 BC gives it a name called melancholia, which means the fear or sadness for a long time. Now, the term depression, meaning the word itself, is very generic, but it means a mood disorder, and there are many subtypes underneath it. It's a very common disease. 1 out of 5 people have it, and the symptoms are sadness, but it also includes a great tiredness, a not wanting to do anything, no pleasure. And this no pleasure idea leads to suicidal thoughts or not wanting to live because there is no pleasure in it, and also poor concentration. When it comes to the causes of depression, there are many things that kind of come together, make a perfect storm, and then push the patient into depression. We definitely know that it's genetic, it travels in families. We know that it can be affected by life events, especially as a child. The more adverse life events a person has as a child, it can greatly affect this disease. It put people at risk for this disease. Certain people who are from small towns, people who are poor, people who are from polluted cities can get more depression. Fun fact, doctors have the highest rate of depression of all other professions, in some cases even 100% more. Certain personalities, like being isolating, not being very social, can put people at risk for depression. Certain medications that are actually good for other parts of the body can make depression worse. Alcohol can make depression worse. Certain drugs like heroin can make depression worse. And actually, exercise is protective. It can make depression better. It can actually decrease the risk of patients getting depression. When it comes to the diagnosis of depression, it's a clinical diagnosis, meaning that there's no blood test, there's no scan for it. It's basically the physician sitting down with the patient, and there's a lot of question and answers, but it's basically symptoms for at least 2 weeks or more, and usually on a daily basis, and then making sure that there are no other causes of the similar symptoms, such as a low thyroid or certain infections or other diseases, etc. When it comes to the treatment of depression, unfortunately, there's a stigma attached to it, meaning there's a lot of negative feelings about it. And this then leads to more than half of patients who need treatment for depression not getting it. And this is sad because if you look at it, depression should be treated just like any other disease. So when a patient comes to the clinic with, let's say, a low thyroid problem, hypothyroidism, which we learned about, and they feel very tired and very fatigued and they have poor concentration, they are given medication and monitored to see if they will get better, and the medication is adjusted accordingly. They are not told to go home and be grateful, to be positive, and to get over having a low thyroid hormone. Same way, when a patient comes to clinic and they have diabetes and they have a very high sugar and they're given treatment for it, they're taught about a diabetic diet, what sugar foods to avoid, etc., to not only control their disease, but to manage it long term. So just as medications can be important in depression, therapy is too, because therapy then teaches the patient how to better control their disease and to manage it long term. And the amazing thing is that almost 90% of patients that get proper treatment for depression actually are able to overcome it, or actually able to manage it. And hopefully, by changing how we look at this disease, changing how we feel about treatment of this disease, will make it easier for those who need help to get it. As Mr. Spock said, change is the essential process of all existence. Until next time.